Taylor, Project Manager for the National Wraparound Initiative. This webinar is brought to you by the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health, operated by the National Technical Assistance Network for Children's Behavioral Health, the TA Network, funded by the Substance Abuse and Mental Health Services Administration, SAMHSA, Center for Mental Health Services Child, Adolescent, and Family Branch. And it's hosted by the National Wraparound Initiative, a partner in the National TA Network. Today's webinar, Turnover Among Wraparound Care Coordinators, Rates, Causes, Impacts, and Remedies, is going to be presented by Dr. Jennifer Schurer Coldiron with the University of Washington Wraparound Evaluation and Research Team. Before I hand it over to her, I just want to invite everyone who registered for this webinar to stay in touch with NWI by signing up for our monthly newsletter. We feature links to NWI resources like this webinar, as well as news and events of interest to the field, announcements about special events, etc. So you'll you'll see our link to sign up on our webpage. And now I will hand it over to Jennifer.
Yes, hi, good morning and good afternoon to everyone. Thank you guys so much for joining us. I'm Jennifer Schurer Coldiron, and as Emily said, I'm with the Wraparound Evaluation and Research Team out in Seattle at the University of Washington. I did want to acknowledge Janet Walker, who is professor at Portland State University and the co-director at the National Wraparound Initiative. She really led this project, and we've been working together very closely for the past year on collecting information via survey and interview, which I'll present here today. Unfortunately, she wasn't able to join us today, but I did just want to acknowledge her involvement in the project. I'm really excited to see the turnout to this webinar. Right now we have over 200, about probably 225 people online, and that's really exciting, and I think it speaks to the fact that turnover is an important and probably nearly universal issue that a lot of you guys are dealing with on the ground. And so today our learning objectives are to learn what the typical care coordinator turnover rates are in wraparound, partly to help you put yourself into context. And we're going to discuss the impacts that that has on youth and families, staff, and organizations. I also hope to help you guys understand some of the major causes of care coordinator turnover, because that's really essential to our third learning objective, which is to explore possible remedies to turnover. So in order to understand what can be done about it, we first have to understand some of the dynamics that are going on. Here's a roadmap of where we're going to go today. We are going to try to keep it to an hour. But I do really want to encourage you guys to please stay logged on until the very end of the webinar. The TA network is trying to get better about evaluating the quality and service, the quality and satisfaction that you guys have with all of our TA offerings, including this webinar. So at the very end of this webinar, you will see a link to a very brief survey, and we would love to get your feedback about whether or not the content of this webinar and my presentation was helpful to you. To start with a quote, Ahrens and Sawitsky in 2006 said that staff turnover in mental health services organizations is an ongoing problem with implications for staff morale, productivity, organizational effectiveness, and implementation of innovation, such as the introduction of evidence-based practices. And turnover, especially in behavioral health and children's services, has been a very well-known issue for many years. But when we get specifically into a wraparound context, almost nothing is known. So we have heard at the National Wraparound Initiative and the National Wraparound Implementation Center, NWIC, we hear a lot of anecdotal information that turnover is a problem. We go out and we do a lot of trainings, technical assistance, and we hear a lot of concerns about care coordinators really churning through the doors of provider organizations. Unfortunately, there's almost no published data about this issue in wraparound. So we still have a lot of questions. Specifically, what are the rates, and are they similar to other public mental health services? What causes some of the variation that we'll likely find? What factors contribute to the variation, and what can be done? So Jana and I, like I said, have been working together on this project for about a year, and it has had two pieces. The first was a national survey that was sent out about a year ago, honestly, from today, to the National Wraparound Initiative's listserv and several other listservs. We got 331 responses to that survey, and on that survey, we asked wraparound providers to estimate turnover rates, kind of reflect on why the turnover was happening and what was maybe causing retention. If they had low turnover, or sort of, what did they think was keeping people engaged in the wraparound as a profession. From that survey, we then recruited people to be interviewed. So we reached out to people who identified themselves on the survey, and we interviewed 21 people in total. We asked them for really in-depth explanations of what was going on, so really to dig deeper into our survey responses. And you can see here that we surveyed and spoke to people all around the country. We really tried to keep this a national survey of what was going on with care coordinator turnover. But we also tried to talk to multiple people in each of the states that we interviewed, so that we could also try to dig into certain system-level issues. Are there certain reimbursement structures, economic factors that maybe lead to turnover being higher or lower in certain states or regions? So you can see that the light blue here are people that are states that are represented in our survey data, and the dark blue are states that are represented in both our survey and our interview data. So we really tried to cast our net wide in order to understand what was going on a national level. So before I share with you what we found in terms of turnover rates and impact, I would like for you guys to participate in a quick poll. And this is just to get a sense of where people are at online and to be able to compare our current attendees with the survey data that I'm about to share. So if you could please here participate, estimate your organization's care coordinator turnover in the past year. So take the number of care coordinators who left in the past year, and it can be the past calendar year or just kind of thinking roughly, in the past 12 months. The number of care coordinators who left divided by the number of care coordinator positions that your organization has. And I'll give you guys a couple of minutes to respond here. Okay. So it looks like a fair number of you guys are sitting in the 1 to 25% range, about 40%. About a quarter of you guys have experienced care coordinator turnover in the 25 to 50% range. But yeah, a fair number, probably about 20% have had care coordinator turnover of over 50% in the past year. So I would like to move on and kind of share with you guys what we found in our survey. It sounds like the people online maybe have a slightly lower turnover than what we found in our survey. We found about an average of 40% care coordinator turnover in the past year. And what you can see here is that it really did vary widely. So about a third of respondents experienced turnover of about 25 to 50%, and a little more than a quarter had turnover over 50%. Also, interestingly, we found that of the care coordinators that left in the past year, 43% of them had been in their job for less than a year. And so we thought this was very interesting and sort of spoke to some of the stuff that we were hearing on the ground when we go in to train and coach. A lot of people are leaving just as they're coming up to speed in the wraparound process. So, it takes several months to train someone, to get them built up to a caseload, and to really start figuring out what is this wraparound thing, to make the necessary community connections. And 43% of the care coordinators that are leaving before they even meet their 1-year mark. So that was a really striking finding that we saw. The perceived seriousness of care coordinator turnover also varied widely. And not surprisingly, there was a substantial and significant correlation between turnover rate and seriousness rating. So survey respondents who reported very high turnover rates also usually rated the seriousness of the problem of turnover to be much higher than respondents reporting lower turnover rates. So not shocking, but also kind of shows people who are really in the thick of it, seeing really high turnover, are really concerned about the problem. When we asked about the impact, what is this turnover doing on the ground, we found that client suffering was seen as the most significant impact of care coordinator turnover. So just over 80% of our survey respondents rated children and families suffer when care coordinators change as a very significant problem, followed by about 2/3 of respondents saying that it increases the workload of care coordinators and about 50% saying that it increased the workload of supervisors. So real impacts on the ground. We also found that about 50% of survey respondents said that the care coordinator turnover had the potential to decrease the quality of the wraparound that is provided, and that it increased training and other costs. And this was really a hunch for the National Wraparound Implementation Center as well, that we felt that the people on the ground would be seeing turnover impacting their ability to provide quality wraparound to youth and families. This really drives home the possible negative impact that turnover is having on children and families. One of our interviewees shared, I think it really does affect our families. Wraparound is such an intense process, and the WRAP facilitators are really invested in the time they spend with families. They gain that trust and build rapport up front within the amount of engagement done in the beginning. So when there is turnover, it creates a level of distrust among whoever steps in next because the family has already opened up. And so, as we know, families really don't want to go through everything again. It's a very intense process to engage in wraparound. And they already have put in all of the hard work of telling their story and opening up and taking a chance on that care coordinator. So I think this quote really illustrates the fact that in order to get the best possible outcomes, we need to have a stable workforce in wraparound. In order to get the outcomes that we want for youth and families, we need to help make sure that those care coordinators are stable as much as possible, that they are consistent, that they bring the family all the way from engagement to transition. So in order to address turnover, we first have to understand it within the unique context of wraparound. And obviously there has been some research and other things about just turnover in general and behavioral health and children's services. But we feel like wraparound is a unique constellation of system level and organizational factors, and it's a unique model. So we wanted to understand for wraparound, why are people leaving? Not surprisingly, pay was extremely common as a reason cited for care coordinator turnover. Low pay leads to resentment and burnout and other stressors that push people out, and salaries are often not competitive within the local economy. So you have the push of the just sort of stress and burnout coming from low pay, but then you also have the pull of other social service employers or other and different industries. So you have multiple factors that are connecting pay with turnover. About 3/4 of our survey respondents said that better job opportunities elsewhere was a significant cause of turnover. It was tied for the top cause of turnover. So before I share with you some information about average salaries around the country and how that compares to median income, I wanted to take a pause and have you guys answer another poll. What is the approximate average hourly wage for bachelor's level care coordinators at your organization? You might need to pull out a calculator if you're used to thinking more about an annual salary. But if you could quickly respond here. If you just have master's level care coordinators at your organization, we ask that you just sit this one out. We're looking for bachelor's level care coordinator average hourly wage. Okay. So we're looking about half of the people responding are saying that the average hourly salary is between $15 and $17 an hour. About a fifth of you guys have less than $15 an hour. Obviously, this probably varies by region and other economic factors. Surprisingly, about 16% have over $20 an hour. Let me share with you on the next slide what we found in our survey. Thank you guys for participating in that. We found across our 21 interviewees that the average annual salary of a care coordinator was $32,500 a year, and that translates to $15.65 an hour. Universally, all of our interviewees felt that the salaries were just too low for the level of skill and stress required. I wanted to share with you some of what our interviewees had to say. One said the $14 an hour, that's how much the care coordinators made in that organization, when they could go to McDonald's and make $15 an hour, really felt insulting. So we talked to some sites where the minimum wage was $15 an hour and care coordinators were, $15 an hour kind of around the area, but in this particular place it was $14 an hour. Another person said the pay for what we do under the stress we're under, it's not good. A master's level person said the Schwann's frozen food delivery truck driver was making more money than I was, and I had a master's degree. A lot of our staff, unless they're living with multiple people, are not paid enough to afford to live in the country or in the county where we work. And probably a third of our staff have a second job. So you can see that the salaries are really creating morale issues. They impact self-worth as a professional. If you see that you're working really hard, you're dedicating yourself to the wraparound model and the youth and families, and people with other skills, perhaps less skills, less stress in their job, are making more than you. This really impacts buy-in and a willingness to put in the hard work, and it impacts people's ability to really have the bandwidth to put up with the job and thrive in wraparound, which is what we want our care coordinators to do. We want them to thrive in these positions, partly for their own fulfillment, but also because that translates into better services and experiences for youth and families. So you can see here that care coordinator salary is often well below the state's median income. It's usually about 2/3 to half as much as the median salary for similarly qualified people in other industries. So this is by state. The blue bar is this 2010 state median income for bachelor's level people aged 25 to 44 years old, which is usually what our wraparound workforce looks like. The orange bars is the average care coordinator salary at the interviewees' organizations. Some of our interviewees did note that salaries are typically a direct function of wraparound reimbursement rates. So some of the organizations don't have very much wiggle room here, and it points to perhaps more advocacy needed at the system level. So you can see here with these sort of economic dynamics, it really makes the pull of other positions and industries very strong. So low salaries can really push people out because they're not feeling valued, but it can also pull people away because there might be other more attractive, more lucrative opportunities elsewhere. Another thing that can really push people out is stress and burnout. It's a really big culprit in care coordinator turnover. In fact, on our survey, 78% of the respondents said that stress and burnout was a significant cause of turnover in their organization. It's no surprise that wraparound families are in need of a lot of support, and therefore care coordination requires a lot of work. One interviewee said, I think when people don't feel like they can get to everything and accomplish all of their tasks, it feels really overwhelming. And I think it contributes to burnout, that lack of satisfaction, the ability to do your job. So I think that really speaks to what all of the interviewees shared, that care coordinators are typically very diligent and very mission-driven and want to do a good job, but they often have reasons that they feel pushed out or pulled by something more enticing. Interviewees very frequently blame the stress, at least in part, on trying to meet productivity requirements. So if you're not familiar with productivity requirements in wraparounds, if maybe you're a case rate state, productivity requirements are requirements that care coordinators spend a certain percentage of their time in direct face-to-face contact with wraparound enrolled youth and caregivers. A lot of sites that we talked to had requirements around 50 or 60%. So I want to pause here again to ask you guys who are on the line, what is your productivity requirement at your organization? Just to get a sense of who's on the line and how it compares to what we found. Okay, so it looks like we have a lot of variation here. About a quarter of people who are responding don't have productivity requirements. That's pretty common to what we were seeing. It seemed very state dependent, really depended on how the wraparound contracts were structured. But for the people that do have productivity requirements, it looks like a fair amount of you guys have over 70%. Like I said, we found usually about 50 to 60% on average in the organizations that we spoke to, but there seems to be a lot of variability here. But most of you guys at least at 30 to 50%, if not all the way up to over 70%. Okay, very interesting. Like I said, we found about 50 or 60%. And, you know, some of the reasons why productivity causes stress and can distract from quality is that it, as one interviewee shared, it just is constantly being under the gun and feeling the anxiety of billables. And it really is missing the whole purpose of wraparound. Interviewees shared with us that this pressure can lead to changes in how wraparound is delivered, and sometimes there's a focus on billables and numbers rather than individualizing the approach to each youth and family. And yes, of course, we want to be seeing our youth and families very frequently, but in order to get reimbursed in productivity type settings, you really have to document things in a very specific way. There's kind of rigid calendar schedules that need to happen. And so that all of those kind of burdens can really cause stress and burnout. And it can be a very specific way to kind of make it an unhospitable environment for people to work in. Other factors also cited as contributors to stress and burnout and turnover were long hours and after-hours meetings, being on call all the time, high caseloads, so caseloads above 12, 15 youth and families. Driving distances were cited a lot, especially in more rural areas or more spread out states, as contributing to stress and buyout. And this was especially true in combination with the high levels of need. So all of these things seem to get in the way of self-care and really compete with personal and family responsibilities. So in our drive to be accessible and flexible for youth and families, that does mean that often if you're a care coordinator, you're kind of working odd hours or you're on call certain weeks of the month. And that can kind of lead to a difficulty of taking care of yourself and drawing those sort of necessary boundaries around your time. A really crystallizing quote from a supervisor at an organization we spoke to said, "When they get up to 12 as a caseload, some of the kids they're working with are so intense that it plays on their own psyche and ability to cope and manage with stress appropriately. I don't think they get as much self-care because they find themselves working more. I really worry about long-term work with this intense of a population." So supervisors are aware of this, and certainly care coordinators are aware of this. When you're working with high needs youth and family, that is stressful. There needs to be time to decompress. There needs to be time to kind of get away from it all. And that can be difficult with the wraparound model. So it's something that really needs to be attended to at your organization. Another thing we found is that turnover itself can also lead to further burnout. So the departure of one care coordinator usually means that their work is redistributed. The family and youth still need to be served. The team meetings still need to happen. So we found that this could really become a vicious cycle. If people are always managing one care coordinator down, it can be a recipe for instability. So if you already have stress and burnout and then people are carrying more workload, they're sort of, kind of dipping into different teams and different dynamics, that's difficult for the care coordinator, and it's certainly difficult for the youth and families that are being passed around. Another thing that we found was that sometimes care coordinators just don't fit with the role, and that can compound stress and burnout. So often there's a mismatch between what potential hires expect and have learned in school versus what the job actually entails. And this can leave them doing a job in a way that really amplifies the stress and contributes to turnover. And I wanted to read you this quote from a particular interviewee. They said, I think if you have people that maintain a clinical mindset, they're not going to understand it, meaning wraparound, and therefore won't stay in it. Helping them understand they're not the sole purpose to get they're not the sole person to get everything done. This is the point of a team, and helping them rely on the team. I think that's when people start to get it. If you have people that don't get that, then yes, the demand of the job becomes too much and people can't handle it. And I have had staff struggle there. So there is a wraparound mindset that is different than clinical work. You're really, as a facilitator, as a care coordinator, you're trying to get things done through other people. That team, those natural supports, the youth and family, everybody should be driving towards the same mission. So it's very different than trying to get things done by yourself. If you just try to operate alone, then the burden is just simply too much. And a lot of interviewees really mentioned that as a reason why people get stressed and burnt out and leave. So the last factor that came up a lot was the lack of advancement opportunities. That really also played a role in care coordinator turnover. So we just found time and time again that care coordinators have few opportunities for advancement. And this, was similar regardless of whether or not you came in with a bachelor's or a master's degree. It was just slightly different. So people with bachelor's degree, one care coordinator we spoke to said that there's really no real advancement as much as there is a lateral move. I could laterally move to a different position, but it would not be in wraparound. And I could never become a supervisor unless I get some sort of clinical license, which is something not something I want to do. Somebody with a bachelor's level said, or a master's level said, once you graduate with that master's degree, there are other employment opportunities for you, even within our own system. So a lot of them, the care coordinators, tend to move on to being a therapist versus staying as a care coordinator. So there's something also with, sort of the desire or the benefits of staying there for a while, of getting to be a really good care coordinator. Care coordinators might be looking around and saying, well, I'm not going to get paid that much more. There's kind of nowhere for me to go. If I'm a bachelor's, but my system requires a master's to come in as a supervisor, what am I going to do? What's the point? And so we found a lot of care coordinators sort of feeling that way. And just a quick poll, last one, just to kind of understand the dynamics of the attendees that we have on the line right now. What is the minimum degree your organization requires to hire a care coordinator? We found a lot of organizations it was a master's, but most were probably bachelor's level. Yeah, okay, so about the same that we're seeing here. So there are some organizations, this is probably a little bit less than we saw with our interviewees, but some organizations do require a master's degree. And in some states, what we found in some jurisdictions, that if they required a master's degree, then part of the reason why care coordinators came on was to get some of their clinical training. And what we noticed is that as soon as they got the license, the clinical license that they needed the supervision for and their clinical hours for, they usually left. Because they could find a much more lucrative job often at a government agency or elsewhere where they could be doing more clinical work. So we saw master's degrees. We saw people coming in with bachelor's degrees that then felt like there was a ceiling. So often in organizations, you could have a bachelor's degree to be a care coordinator, but you needed a master's to become a supervisor. And that really stifled the growth of care coordinators. So that, the fact that there wasn't very much advancement was another reason for turnover cited. So those, that in a nutshell, very quickly, were the causes of turnover, specifically within a wraparound context that we found. But I think most importantly, we wanted to spend some time talking about possible remedies, because we did talk to our interviewees a lot about what's going well, what's working in your organization. If you've been able to turn around the whole issue of turnover, what did you do differently? And here's some of what we found. And hopefully these are concrete enough that you can bring them back to your organization. One of the main themes that emerged from our interviews was that supervisors are key to reducing turnover. One of the care coordinators that we spoke to said, I have a very supportive immediate supervisor, and I think that's key. I think a position is made by the supervisor. is so important. We heard this over and over again, and it is really consistent with research. Research says that the number one reason why people leave a job is because of issues with their immediate supervisor. And this is no different in a wraparound context. But wraparound supervisors, have maybe a bigger job. They have to train and coach and build skill. They have to provide moral support and clinical guidance. They also really need to reduce or buffer against stressors and strategically lift burden. So a supervisor at a low turnover organization said to us that what she likes to do is trying to balance as far as letting them select time, letting them be here one day longer and then take off earlier a different day. This particular interviewee said, I have started, hey now, put your filing in here, we'll take it down to the chart room and we'll let it get filed weekly. That way you guys don't have to take that extra step. So here is an example of sort of lifting burden wherever she could. And she said, I've been working on getting them laptops. That way they can be mobile and hopefully do notes on the go. Just about anything and everything we can think of creatively. So a lot of these things don't cost extra money. May take a little bit more time and effort, but can really reduce burden and can really tell the care coordinator that their supervisor has their back. Kind of taking a global view, what are the roadblocks to helping people be as productive as possible and as engaging with youth and families as possible? Another piece that we saw, and again, this is very consistent with the research, is that skills coaching, whether provided by a supervisor or another person, can really help. Targeted focus on supporting improvement in practice skill can combat burnout. It's not just good practice, it actually makes people less frustrated. So one person said, I really believe having a good coach is important. They need to be able to contact their state coach and get feedback that they need, and I as a supervisor don't have all the answers. When they can't get that and they get the wrong answer, that creates frustration and has been an issue. So again, care coordinators want to do a good job. They want to feel capable. They want to feel like they know what they're doing. They want to feel comfortable that their supervisor knows what's going on and can really help them with that and can help them build the skill to be an effective care coordinator. That really leads to less stress, less burnout, and less turnover. In addition to developing skill and supporting care coordinators once they've been hired, we also found that hiring the right person from the start can really make a difference. And so this can be improving your hiring practices, such as having behavioral questions. So questions like, give me an example of a time when, or describe a stressful situation and how you handled it. So questions that really dig into how the interviewee reacts to certain situations, how they tackle problems, how they cope with stress. That can really give you insight into how this person is going to operate. Another thing that we saw is the opportunity for job shadowing and being really clear about the role descriptions. So if you remember the quote that I read to you before about sort of the wraparound versus clinical mindset and the idea that you're trying to get something done through a team, that's really important. And sometimes people just don't get it. They don't understand that. It's hard to kind of explain, especially when people have been trained in a particular way. So we really like this example. One interviewee in a low turnover organization, now a low turnover, has done this. She said, when we have, what we have changed in the last few years before people actually say yes to the job, if they have passed our interview, we ask them to shadow one of us before they actually say yes to the position to see if it's really what they want to do. I have a ton of new people that have come out with me and have said, this is not for me. They said it was very helpful to see what we actually do instead of hearing it. So this is an example of a pretty minor change to the hiring process, but can really screen out very quickly those people that maybe aren't cut out for the job. It saves them time, it saves you time, and it can really help you find those people who get it, understand it, and are energized by the wraparound process. In addition to getting the right people on the bus and giving them the needed skills, a strategy to reduce turnover is also to lower or just get rid of completely productivity requirements. This graph that you see here is a breakdown of care coordinator time spent delivering wraparound. This is based on a time study conducted in Florida by Vroom Vandenberg, and you'll see that about 36% of their time was spent on family contacts and team meetings. Those are things that are billable typically. The rest of the time is spent on things that you would argue are still very important pieces of wraparound and of workforce development, such as travel. If it's a community-based intervention, you need to be traveling out to the youth and family's home and other service settings. Having collateral contacts is key to getting that team. And documentation, also very important, as is the supervision, coaching, staff meetings. But you'll see here only 36%, whereas we found that most of the organizations with productivity requirements that we spoke to had about 50 or 60%. And you guys on the line, some of you had over 70%. That's really challenging to work in that sort of environment and deliver wraparound to fidelity. So what Vroom Vandenberg suggested from this time study is a productivity requirement of maybe more around 25%, if that's more reasonable. Obviously, that might require some advocacy, some change in your fee-for-service rate, or figuring out other funding structures. Some of the organizations that we spoke to that had changed their productivity structure, ways that they figured out how to align their funding accordingly was instead of paying for billable hours, they got a chunk of money every time they held a child and family team meeting. So the payment might be roughly the same. It was something to allow the organization to break even at least, but it was aligned more with basic wraparound practice. So there was an assumption that if you held that child and family team meeting, you had been actively managing that team. You had been meeting with everybody necessary to pull everybody together. Other organizations that we spoke to were simply paid based on staffing. If they had people up and ready to go, they got paid based on that, and it was the state or other referral sources' job to get people into the wraparound program. So those are just some of the things that we found. The other piece, you can reduce productivity requirements, but those have to be balanced with a case rate or some other reimbursement structure that still allows for a living wage and a competitive wage. I think the most striking, it wasn't surprising, but it was really striking to hear how little a lot of the care coordinators were being paid out there. And what we found is that people really thought very modest pay increases would make a difference. So, people who said, we just need more pay, we always followed up with, how much would be enough? And we were pretty surprised. Most people said that just an increase of $2,000 to $3,000 a year would make a difference, that would improve retention. Another thing that people suggested is to create some sort of step structure to really entice longevity. So you come in at a certain level. If you have been showing good skill development, you've been there for a certain amount of time, then there's a step maybe to a senior care coordinator or something like that. So this really speaks to the idea that we need to give care coordinators something to look forward to, some sort of benefit of sticking it out, doing the hard work, developing their skill, and becoming really good wraparound providers. So some organizations have created senior care coordinator positions. So again, somebody who shows a lot of skill and a lot of diligence, maybe takes a slightly reduced caseload and adds on some coaching or some training aspects really to support their fellow care coordinators. Some other jurisdictions have created local or state-level coaches or other trainers. So again, if you have something to look forward to. If I do this for the next 5 years and I get really good at it, I can kind of have a step in my career advancement, and that would be worth it. So another thing that we found is that retention is enhanced when an organization's values really resonate with staff. Our interviewees stress the importance of a climate and culture that understands wraparound and supports its values. So not just for working with families, but also for staff. It's a challenging job. They do better in organizations and cultures that really emphasize strengths, that value wellness and self-care, celebrate accomplishments, really recognize that hard work, but still promote teamwork and fun. That can really make people feel very loyal to the wraparound process and to their organization. So one interviewee at an organization with low turnover said, "The work is tough and hard, but we have support around getting it done." At any given time, if somebody walks through, you'd hear laughter, you'd hear joking, but then you would also realize, wow, they get their work done. So there's high standards, but also high commitment to organizational culture and climate. This is similar results that we found on our survey, that retention is really enhanced when the values resonate with staff. So the number one most significant cause of employee retention was the commitment to children and families they work with. So this is sort of a personal attribute of a care coordinator, and this is something that you need to hire for, something you need to screen for. Are people really committed to the children as well as the families? About 90% of the survey respondents also said that people stay because they're committed to Wraparound and they really enjoy the work. This is something you can develop through good training and coaching to make people really understand what Wraparound is, to build their skill. The next two things, the support from and loyalty to coworkers and loyalty to organization, those are things that you can develop by attending to organizational culture and climate, really participating in active team building and norm setting, and making sure that it's a good, supportive place to work at. So what can you guys do next? What are your next steps? What are our next steps? We strongly suggest that you start by understanding your own drivers of turnover. Obviously, we tried to get a very national picture, but we found a lot of variability on a local level. So some of the things that I've covered today might be really what's going on in your organization. There might be other things. We really suggest that you track your own turnover rates. Look at it every quarter. Look at it every 6 months. Really try to understand, why are people leaving. So conducting exit interviews is a great way to do this. People often speak very freely if they have one foot out the door. They might give you really good information about ways to reduce burden, barriers, support them more. Also, we suggest gathering information if you can. And this could be through a paper survey or an online survey. Try to understand people's job satisfactions. Figure out if they think that their supervisors are competent and supportive. Get feedback about job conditions and the management. These are all pretty easy things that an organization can do fairly routinely to be able to identify if things are going off the rails before you get turnover of 50, 60, 70%. If you can really identify the changeable, malleable factors, then you can act on them. And so I just want to leave you guys with a couple of examples of some creative responses that our interviewees had shared with us. A really common one was documentation reduction initiatives. So, obviously documentation takes a lot of time and can be pretty frustrating. Organizations that have attended to streamlining things, reducing unnecessary assessments that maybe aren't being used, trying to figure out just however possible to reduce documentation burden, that has been helpful. Another very common strategy that we heard was adding technology to aid in efficiency. So making sure that people have tablets and laptops, and that they have, if possible, offline access to the EHR or other documentation systems, so that if you have a care coordinator that has driven an hour and a half to see a youth and family, and for whatever reason they're not there, they're not able to keep that appointment, that you don't have a really frustrated care coordinator because they just lost all of that time. Maybe they need to wait for the youth and family for a half hour or an hour. Now they can get something done. That can really improve productivity and reduce stress and burden. Some other things that I've sort of touched on already are training to enhance the understanding of the role, to really make sure that people understand what they're getting into and have built that skill. Kind of playing with different staffing patterns, maybe trying to play around with when people are on call. We heard one organization always pairs a peer support, a family partner with a care coordinator, and they kind of balance caseload together, so that care coordinator has another professional who they can work with and that can kind of reduce feelings of isolation, can give them a feeling that they have somebody else has their back with this youth and family and the team. And as long as it's very clear sort of whose job is what kinds of things, that can be a very interesting way of reducing burden on care coordinators. We also heard, or enhancing hiring for better fit. I think I've covered that already. We also have heard from organizations who really have invested in wellness and self-care initiatives. So having an employee assistance program, having a health fair, in getting involved in a walkathon, just other ways to build community, having yoga once a week at lunchtime or something like that. Some of the organizations were really trying to build the sort of de-stress, normalize those sorts of activities, and make it a team-building opportunity as well. And lastly, we did hear some organizations really trying to engage in policy changes within their agency or within the larger local and state context. So this is where you get into issues of what is billable, what is a reasonable case rate, how can you reduce certain requirements, how do you align things more with the wraparound model. There's a lot of opportunity here that might require organizations getting together. So don't just feel like you have to fight it yourself, especially if it's at the system level. Create work groups, learn from your peers, try to figure out ways to make the context and the requirements on your care coordinators as burdenless as possible so that they can really focus on the youth and families and delivering wraparound to a high quality. Our next steps are to track comments on the National Wraparound Initiative's blog post. So Janet Walker, my colleague, has written a couple of blog posts about this topic on the NWI website, and if you have comments or have questions, we will be tracking that. We are continuing to kind of look at other opportunities to continue to explore this topic. We also are releasing a final report. It's just about a 12-page document with a lot of graphics, a lot of quotes that will be a nice addendum to this presentation. It's currently being reviewed by SAMHSA, and it should be available in the next couple of weeks. So be on the lookout for that on both the NWI and TA Network websites. We also do hope to write a journal article. This was most important for us to get out as a webinar and as a report so people in the field can really start to engage with the information and hopefully make some changes on the ground. But writing journal articles is also very important to kind of move the field forward. And we also are going to talk to our partners at the National Wraparound Implementation Center to figure out, does this inform how we are approaching workforce development? If 43% of people who are leaving within their first year, what does that mean about training and coaching? How can we make our training and coaching more flexible so that it meets the needs of organizations even in the face of high turnover? And lastly, we do hope to further explore supervisor turnover. We did ask about that in our survey, and while we found that supervisor turnover was lower than care coordinator turnover, it did seem to have very large impacts. So that it can destabilize a whole team. It can really lose that institutional knowledge and become a vicious cycle. So we hope to also look at that. And that is it. I think we have a little bit of time for some question and answers. As I said, please try to stay on so you can have a chance to take our evaluation survey. And the slides will be available on the NWI website in the next couple of weeks.
Jennifer, that was a fantastic presentation, and from the comments and questions we're getting, it's obviously resonating really with the audience.
Okay.
We do have time, and there are several questions. I don't know if you've had a chance to look at them in the presenter chat, Jennifer.
I haven't, but I will look at them right
Okay,
now.
no problem. I can kind of relay some to you. Like I say, there were several. Mm-hmm. One question was if you could offer a reference for the number one reason people leave their jobs, which was because of supervisor.
Sure. I do not have it at the tip of my fingertips, but I will make sure that it gets up on the NWI website, either as a comment to the blog post or just as a separate blog post.
Great. There was also a question wondering about videos of a CFTM in action that could be used instead of shadowing, and a related question wondering if potential hires shadowing causes any issues with HIPAA and family privacy.
Yeah, both very good questions. Yes, I think that a video of a child and family team meeting could be a good proxy if it's kind of a typical meeting. I think that works. I think it is more effective for somebody to actually go out into the field, kind of get a sense of what it's like to actually meet with a youth and family in their home or at their school. Sort of being there is just a different experience. However, if that's not possible, then yeah, I think a video is perfectly fine. Whatever you can do to kind of get people to get what Wraparound is. In terms of the HIPAA issue, it's only an issue if the youth and family doesn't feel comfortable doing it. You might have a couple of families who are more than happy to sign a release and say, you know, this person can shadow. I understand why they're here. It's really just about getting those releases. But it might differ at your organization. Every organization has different privacy requirements.
We also had a question from someone who wondered a little more information about what a state coach is and what their role is.
So a state coach is something that we advocate for at the National Wraparound Initiative, or National Wraparound Implementation Center. And essentially they are a very skilled person whose job it is to support organizations around the state or around the county or whatever the jurisdiction is to focus on skill development. So they might review plans of care. They might review other types of documentations. Maybe they will occasionally go observe practice. So it's an additional person to reinforce quality skill. Whereas a lot, supervisors have a lot of things on their plate. They have to be looking at HR issues. They have to be looking at authorizations, paperwork. There's lots of things that can crowd out a focus on skill development. And so the purpose of a state or local coach is to have somebody being simultaneously focused or like solely focused on issues of practice. So it's just another way to reinforce skill development.
Wonderful.
Yeah, that's a good question.
Another question wondered in terms of retention of care coordinators and turnover ratios, do you have a sense of what percentage is attributable to the lack of admin support? I don't know if that was included at all in the survey.
I don't. I'm not sure what you mean by admin support, if it's sort of like paperwork or that sort of thing. But that didn't come up. It wasn't something that people talked about necessarily. It looks like Elena might be clarifying what she meant there.
Okay, maybe we can move on to another one.
Maybe we can get to another question.
Someone was wondering how a WRAP program could fit into a for-profit organization.
That's a very good question. I don't think I'm prepared to answer that.
Okay,
I'm not really sure.
No problem.
Yeah.
I know it's hard when you're not the one.
It's a good question, and it's something that we could continue to look at. We're always researching and trying to understand the best system structure, the best funding structure, kind of how Wraparound can be delivered to the highest quality, most efficiently. So it might be that that's in a for-profit venue. It might be that it's, we pay a lot of attention right now to care management entities. There's a variety of settings in which Wraparound is happening. And that's part of what we're always trying to look at is there one way that's more advantageous than another? But I don't think I have a specific answer for for-profit versus nonprofit.
What about this, maybe in the research you could help answer this question a bit or lead someone to where to find out more. How do these turnover rates compare to other models or other mental health workers?
I would say they're somewhat comparable, maybe a little bit higher. We found in the literature around just behavioral health care or children's services, sort of working with similarly intense populations, turnover rates between 30 and 60%. There's a lot of information out there about how turnover is a problem. There's actually very few studies that we found that actually pinpoint a number. So that's part of why we wanted to do our survey and try to understand it in Wraparound. But I would say this is probably similar, if not maybe a little bit higher, but I don't think it's completely anomalous. Yeah. Maybe
Great.
just one more question?
Let's see. We're getting a lot of positive feedback for you, which is great. And then
Thank you.
the more sort of comments noting that the level idea is wonderful. And someone said the senior care coordinator is a great idea. And another person commented that in their organization they call the senior care coordinators leads, give them a pay raise, and have them be part of the management team.
Yes, that's very important. They don't have to be on the level of a supervisor. They can really play a unique role. And it's a great way to honor the experience of a senior care coordinator and can really help build the skill of people that are coming in below them. Yeah.
Fantastic.
So thank you guys so much. I really appreciate all of you guys staying on the line and participating in all of the polls. Like I said, this will be available online on the NWI website and the TA Network website shortly, probably in the next couple of weeks. And we will be sending out links and announcements when the final product is also available. So it'll be a pretty engaging guide that hopefully you can use with your staff and your administrators. So thank you guys very much. I'm going to advance to the last slide. Please, please, please click on this link here. Give us some feedback. It'll take less than 5 minutes. We would love to hear what you had to say about the webinar, and it helps us inform webinar plans in the future. So thank you guys so much. Good luck out there. Have a good week. Thank you.